My name is Dr. Paul Saba. I'm a family physician here in Lachine, Quebec, Canada. I have worked in intensive care and critical care situations. I'm also president and founder of the Coalition of Physicians for Social Justice. We're in the middle of a medical crisis that has been manufactured because the government has been totally incompetent. They have failed to solve a problem that they've created. Right now they're saying that we're not going to accept, they're not going to accept people who are in critical care, have critical care needs, because there are not enough beds or not enough staff. And they're requiring people to have a 70% score, which is like trying to get into Harvard, or 70 or 80% score, which would be like trying to get into Harvard Medical School. And these patients who could be in the 30s or 40s or 50s, who have high blood pressure, diabetes, or some underlying condition, will not be given life-saving care because they have COVID. And they've created this problem because it's been years in the making, because of lack of training enough nurses, because of hiring, which is not giving nurses full-time jobs, and work conditions which are intolerable for nurses. So this is totally unacceptable. The nursing crisis also is a reflection of how we've mistreated our nurses. Our nurses have been overworked, they've been overabused, they're stretched to the limit. But that doesn't mean we can't fix the problem and we just can't throw in the towel. It needs to start right from the beginning. I mean, for example, we have nursing schools who are ready to graduate nurses. Let's graduate them a few months earlier, get them in clinical situations with support, with proper supports. Nurses who are working need to not be answering phones and be looking for compresses and different medical equipment, because that's the situation as it exists on the floors, because there's a lack of equipment. And they also need support. They shouldn't have to be giving bathing patients. Patients need to be bathed, and we need to get support, nurses' aides, for example, to provide that support, whereas the nurses can be used in really situations, making sure patients get the proper medications and overseeing their care. And nurses who have graduated, who've retired early, or who've left the profession, or have gone to other things because they're just so burnt out, need to be brought back, and with incentives. It could be tax credits, it could be bonuses. We need to get the system working, and in the long term, we need to train more nurses. And instead of allowing this crisis to continue with the shortage of nurses, respiratory therapists, and other support staff, the government needs to find creative ways to get the system working, and they can do it. And we need to care for our nurses. We need to care for our patients. Basically, that's what the bottom line is. Government has no excuses abandoning people, saying, well, we have a crisis and we can't do anything about it. They can do something about it. They can fix the problem. They've created it. Let's fix it now.